Hi, my name is Dr. Amy Newberry, and I am the owner and founder of Pelvic Prescription Physical Therapy and Wellness in Wilmington, North Carolina. Today we're going to be talking about the male pelvic floor muscle exam. And there are several indicators that would let us know that this exam may be appropriate for you. And that is if you're experiencing any of the following symptoms. First of all, urinary symptoms such as urinary leakage, urgency, frequency, or bladder pain. Also, any sort of bowel problems such as constipation, stool leakage, or rectal pain, as well as penile pain, pelvic floor pain, pain with ejaculation, pain with erections, and so on. Now, if any of these symptoms are something you are experiencing, then finding a pelvic floor therapist that is trained in male pelvic floor therapy is highly important and can actually help you solve the problems that you are experiencing right now. Before we get into the actual exam procedures, we're going to talk about where your pelvic floor is. So your pelvic floor is the muscle group at the base of your pelvis, and it spans like a hammock at the bottom of your pelvic girdle. These muscles are very important in controlling your bladder and bowel function as well as your sexual health function. And any sort of problems that you might be having in those three areas can be caused by these muscles. So if these muscles are too tight, that could give you feelings of leakage, urgency, frequency, or pain. If these muscles are too loose or relaxed, you might have the opposite problem. You might have too much, you might have like rectal prolapse, or you might have leakage as well. So it's very important that you see a highly trained professional that can assess the function of these muscles and get you help as soon as you can. There are three main options for having your pelvic floor muscles examined. And the first one is the most indirect and least effective method. This would include the patient being fully clothed and the therapist donning gloves and the patient laying on their side on the table. In this position on the side, your therapist can palpate the external portion of your pelvic floor muscles, which is all of this pink right here, by putting pressure between your sit bone and your tailbone right here. And your therapist would have you contract and relax your pelvic floor muscles to make sure that you have full range of motion and no pain while doing this, as well as no urgency symptoms. Now, the second method is a little bit more direct, and that would include an external pelvic floor muscle assessment without clothing. Your therapist would have you undressed from the waist below, lying on your back on a table with your knees bent and your feet flat on the table. During this exam, your therapist will also give you a sheet to cover yourself with, as well as a towel to cover the male genitalia and move it out of the way. So in this position, we're going to switch models real quick. You'll be laying on your back, everything pulled up and away to expose this superficial layer of muscles, which can be the driving factor behind any sort of bladder urgency, bladder pain, even sexual health. And so your therapist will first have you go ahead and contract and relax these muscles here to make sure that you have full range of motion. Secondly, your therapist will also gently palpate the structures externally here to make sure that these muscles aren't causing any pain or urgency symptoms or any symptoms that you might be experiencing. And if any of these muscles is a driving factor, then the muscle, when your therapist palpates it, it will cause your symptoms that you're feeling. The third and final technique for a pelvic floor muscle assessment is the most direct and most effective way to assess the pelvic floor, and that is through the intrarectal muscle assessment or through the rectal canal. This would involve the patient undressing from the waist below, laying on their side covered with a cover sheet, and pulling the male genitalia up and out of the way. Your therapist will be able to assess the pelvic floor muscles using a gloved hand in order to gently palpate the structures over here to make sure that they're not contributing to any of your symptoms, whether it's urgency or pain. It can also tell us a lot about your range of motion, so your therapist will have you contract and relax your pelvic floor to make sure that you have full control of these muscles. Now, the internal portion of the assessment involves assessing the superficial layer as well as the deep layer of the pelvic floor, and that would involve one gloved finger inserted into the rectal canal And your therapist will have you squeeze and relax to make sure, again, you have full range of motion, as well as palpate all the muscle tissue around this area to make sure these muscles are not contributing to the symptoms that you're experiencing. And if they are, then that will give us an indication of what is the root cause of your symptoms. Your therapist will assess the superficial layer as well as the deep layer with the same technique, checking your range of motion and checking for any pain or tenderness internally. You can speak to your pelvic floor therapist to find out which technique would be best for you and what technique you are most comfortable with. There are multiple ways to assess the pelvic floor, and we talked about the main three, going from the least direct to the most direct. And it also depends on the symptoms you're experiencing. If you're experiencing more urinary symptoms versus bowel symptoms, you may be more appropriate for one technique versus the other. It's also possible that you can talk to your therapist about learning how to do a self-assessment in order to provide your therapist with information if you're not comfortable with the pelvic floor assessment. What I want to leave you with today is to remember that you and your therapist are a team and that you can discuss your preferences and your symptoms with your therapist so that you and your therapist can come up with the best option for you in order to address the symptoms, whether it's urgency, leakage, or pain, at the best of our ability together. So please speak with your therapist about which option would best fit you and get started on solving the problems that you're experiencing.